It's my pleasure to welcome Dr. Ngozi Okonjo-Iweala. She has a very long list of accomplishments, so I'll only highlight a few here. She is chair of the board of the Gavi Alliance, that's the Global Alliance for Vaccines and Immunizations, and former finance minister of Nigeria. She has also served as managing director at the World Bank and is currently chair of the African Risk Capacity, an agency of the African Union that helps member states prepare for and respond to extreme weather events and natural disasters. Dr. Okonjo-Iweala, thank you for joining us today for this TIME100 Talks.
Thank you, Alice.
We are seeing an unprecedented show of force in response to this pandemic, to COVID-19, from governments, the public sector, as well as private sector and philanthropic organizations. Gavi is a great example of this. It works with the WHO, UNICEF, the World Bank, as well as the Bill and Melinda Gates Foundation, governments, and corporate partners. It really takes a village. Can you describe why each of these partners are so important to fighting a pandemic like COVID-19 and what each brings to the table?
Thank you, Alice. Well, COVID-19 needs an international effort. It needs the cooperation of the international community to do it. So both philanthropic organizations, multilateral organizations, they all bring something special to the game. And in the case of Gavi, it's the Global Alliance for Vaccines and Immunization. So actually it's an alliance with WHO, UNICEF, the World Bank. We're all part of that alliance. With respect to the WHO, of course, everybody knows that this is the global organization for world health that looks at all the issues, including regulatory issues surrounding the health of the whole population. And for this COVID pandemic, WHO is the organization that decides when something becomes an epidemic and a pandemic, when it's an emergency of global proportions. So their role is very important. WHO, of course, also has the duty of regulating and pronouncing on different kinds of treatments and drugs. And it has very specialized committees that helps it to do this. And setting out criteria for us to know that the quality of certain types of treatments and drugs is okay. All this comes from WHO. So WHO is a very specialized and needed agency in the world. I'm just describing some of what it does, but among other things. So that's why it's an important part of this endeavor. Of course, philanthropic organizations like Bill and Melinda Gates. You know, Bill and Melinda Gates Foundation is one of the foremost foundations working on vaccines for the longest time. And there's a lot of expertise housed there. They are also big funders of healthcare all over the world, both in the United States and outside, and globally through WHO. So they also bring something. With respect to Gavi, the foundation is actually the second largest funder, and I think it's the biggest investment of the Bill and Melinda Gates Foundation. So all of us are in this together on this COVID-19, from the research into vaccines, which Gates is involved with others, to the regulatory issues and the quality issues and oversight issues of WHO, to Gavi, which makes the vaccines available in an affordable and equitable fashion to the rest of the world. If Gavi did not exist, you would have a situation, and that has happened in the past, where life-saving vaccines come out and only the rich countries can get access.
And you've recently written about the urgent need for a vaccine and for COVID-19, and made the argument that it's not just a public health necessity, but it's really a global good. That's the right of every human being on this planet. Why is a vaccine against COVID-19 so important for the world?
COVID-19 is a virus that we've never seen quite before. There have been other coronaviruses, but this one seems to be different because so little is known about it, and it spreads so rapidly. So that means that no one in the world is safe until everybody is safe. no country is safe until every country is safe, because it can go from one to the other. In that circumstance, it means that the entire world should be interested in making sure that everybody is vaccinated against this. And that is why the vaccine must become a global public good, that where the issue is not about profits to be made, but the issue is getting access to all of humanity for this vaccine.
I want to bring in a question here from one of our viewers from Nigeria, Daniel from Nigeria, who asks, how can we demystify the myth trailing the COVID-19 vaccine and the fear surrounding the pandemic? You talked about the importance of making sure that life-saving vaccines are distributed throughout the world, and yet many of the ones that we know can help prevent diseases at this point, the existing vaccines, aren't still reaching many of the people who need them. How does an organization like Gavi address that issue, both of stigma as well as, you know, practical problems of distributing something like a vaccine to anyone who needs it?
Well, first of all, let me address the distribution issue. Gavi has built a platform and has financial instruments which it uses to make sure that enough volumes are produced of any vaccine. We have something called the Advanced Market Commitment, which enables us to incentivize manufacturers by working with them on large volumes, committing ahead of time to purchase enough volume that will make it worthwhile for them to do this. We also have advanced purchase commitment, which enables us to actually pay upfront for certain vaccines to be produced. And we've deployed both instruments in the past very successfully. So with that, we hope that we can also use the same instrument for COVID-19. It's going to be an absolute challenge, because this time we're not talking of millions of doses. We are talking of billions if we are going to reach the whole world. So it will be a regulatory issue, it will be a logistical issue, it will be a financial issue. But working together with WHO, with CEPI, the Coalition for Epidemic Preparedness, Gates Foundation and others, I think this international effort combined can help us deliver on the distribution and the affordability. Gavi has been able to negotiate in the past to dramatically reduce the cost of vaccines. For example, certain vaccines that may cost $100 a dose, Gavi is able to negotiate it down to $4 or $5 because we deal in large volumes, so we can promise quantity and the manufacturer can still make a margin. So that's on the distribution and equity affordability side. With respect to the issues of stigma and the anti-vax movement, that's a lot more difficult. I understand that and know that right now there's a lot in social media, there's a lot of fear. First, there's fear of COVID-19, because people have never encountered this before. And then there's fear of what this brings, which leads people to be afraid of the vaccine. All I can say is that people should remember that if not for vaccines, many of us would not be here. We would have died as infants and children. Vaccines have saved so many lives, and we can give you actual statistics. For Gavi, since it started work in 2000, we've vaccinated 760 million children, and we've saved 13 million lives that would have died if not for that. So if you apply this to the COVID-19 vaccine, the vaccine is for good. And I can tell you that there'll be no chip. Some people are saying a chip for tracking people will be put inside, and other kinds of myths. We just need to work with civil society, with communities, with media like yourself, Alice, to spread the word that when this vaccine is available, no one will allow it to be administered unless they are sure of the safety and the quality.
How difficult has that been with other vaccination immunization programs? I know that Gavi has been very active in addressing some of those social and cultural barriers as well. How successful have they been, and could you just comment briefly on some of the programs that have worked best? Is it working with local leaders what's worked best to really address some of those very deep-seated concerns that some people have about vaccines?
I think that I can take the example of polio, where even in my own country, there was some, anti-vax feeling against it at a certain point in time. In other places, parts of Pakistan, India, and so on, you have these flaring up. And I think working together with the Bill and Melinda Gates Foundation, getting down to the ground with religious leaders, with traditional rulers, with women's societies, with community leaders, working through women's organizations. All these channels, church groups, have been used as ways to try and get the information to people to say, this works. In fact, in my country, some of the policymakers and the ministers and president took their own children to be vaccinated in public so people could see that this is not harmful. So I think you deploy all the means you can to be able to do this, to convince people.
And before we leave vaccines, I wanted to ask you about the importance of having campaigns already in place, even before we have a vaccine. Looking at where we are right now with the research and development, when, in your view, do you anticipate that we will have a vaccine? And are the measures to sort of make sure the economic measures, these social and cultural measures, already starting to be put in place, anticipating for when that's going to happen?
Well, I always hasten to say I'm an economist, not a scientist. So we have to listen to the scientists on when a vaccine would be available. Sometimes, most times they say not for 12 to 18 months. And it may not be one vaccine, it may be vaccines, I think, which would be a good thing for the world, because that will mean that we can have many more available for everybody. So that's the timeline, and everybody is very hopeful. Occasionally, I also hear there may not be a vaccine, but I think everyone is cautiously optimistic that there will be one. So because of that, the international community with the WHO at the center, Gavi and so on, have started thinking, what do we need to start to do now to mobilize the resources to make this possible, and to start talking to people and laying together the logistics, which is quite complicated, for getting it done. The European Commission, I think a week ago, had a fundraising event led by Ursula von der Leyen, the president of the European Commission. There were many heads of state from all over the world, and they raised about $8 billion towards the economics of this, to be able to support the development and manufacture and begin to incentivize the distribution. So the platform is being created even as we speak. We have started already.
That's great to hear, and I'm not surprised that it's already underway. Mm-hmm. There is an intimate connection between economic development and health, and that's something that you, of course, are quite familiar with, but that many countries, I think, might have taken for granted, as we're seeing now with building clashes between public health needs and economic pressures. As both an economist and a public health advocate, you're really a bridge between those two competing forces. So I'm curious about where you stand on this question of how best to balance the pressures to reopen countries for the sake of the economy and the public health pressures to stay closed, for the right amount of time in order to control the virus. I'd love to get your perspective as you're seeing what's happening around the world and hearing about countries reopening and some of the resurgences of cases in those countries. What is your way of looking at the best way to balance those two forces?
It's a really difficult question and a really tight challenge. And as you say, it's both a health one and an economic one. My own particular bias, and this is my personal opinion, is I tend to want to see evidence that on the health side, things are beginning to improve before one starts opening up, even though I know the economic costs are heavy. Why do I say that? Because the longer the health issues linger and are not properly dealt with, the later you will pay a heavier price economically. So I tend to say, on the balance, let's make sure that we're on the downward trend with respect to the number of cases of this virus before we start opening up. Several countries have good examples. New Zealand, for instance, they had a very quick lockdown, and now they're opening up, or they've opened up in a phased and careful fashion. And I think that works. So we do have a few countries to look to as to what is a good way to do it. I think you need a plan.
That makes a lot of sense. And I know it's a very difficult question that many countries are grappling with right now. I want to move on to another very difficult issue, but you've spoken eloquently about the connection between public health and another big issue facing our planet, which is climate change. Why is clean and renewable energy so important to combating a pandemic like COVID-19?
Well, I think, if the world does not work on issues of climate change, you face, right now we have what is called a perfect storm in many countries: economic crisis, health crisis, and certainly you don't want to add to that also a climate change crisis. So that is why we have to act now, because not acting on climate change will compound the number of issues that we have to deal with. If you notice, during this time of little activity in the world, many pictures were shown of cities with clear skies, which many of us had not seen before, be it Beijing or New Delhi or San Francisco, or all these places we were able to see, which shows you that there's a very big problem. You know that pollution is a climate change issue that also takes many lives. And you know that people whose lungs are compromised are very susceptible to COVID-19. So this is a real issue. If we continue to pollute the atmosphere the way we are doing, and we have this pandemic, we could be compromising a lot of people whose lives will go. And we don't know the way the weather will warm or cool going forward. And that can give rise to all sorts of viruses that we are also not familiar with. So that is why we cannot forget that we need to move towards a cleaner atmosphere, a cleaner environment, and that all these things are not divorced from each other, but are related, and we have to handle them together. We need to build back better. So that's my final point. If we are going to inject some economic stimulus into our economies to recover from the ravages of this pandemic, let's not go back to the old ways of doing things. Let us build infrastructure in a way that is more lower in carbon emissions and more climate friendly. That means moving towards things like solar and renewables. And that's why I make that link. We can't go back to business as usual. We need to go to business unusual.
And finally, in closing, I want to just bring in a question from Raj Kumar from India, who asks, how would you change the world for good after COVID-19? And, obviously he's referring to what you hope emerges from this pandemic to make the world a better place for everyone.
That's an excellent world question. I think we need to learn some lessons from COVID-19 that should want us make the world better. One is the vulnerability of the whole world. I think it must have been amazing to many people in poor countries to see that the health systems of rich countries were also overwhelmed by COVID-19. So the feeling of we're all in it together is very important. So when we come back post-COVID, we know we need to work with each other. And that brings me to interconnectedness. This pandemic has also shown that you cannot sit safely in your rich country or your poor country and think, I'm fine, I'm safe, I've dealt with my own problem. That doesn't work. This involves everybody. We are so interconnected that after COVID-19, I hope that those kinds of associations that bring the world together, that multilateralism that we need in order to survive, that we'll go back to it and strengthen it. Because without it, we will not be able to make it in future. This is not the last pandemic we're going to have. There will be others. So we better make the world a better place now and look out for each other. We better make sure that those at the bottom of the ladder are not pushed further back, that inequality is not exacerbated. Let's bring everyone up so that we can survive and not perish.
A good reminder for everyone. Let's bring everyone up. Thank you, Dr. Okonjo-Iweala, for sharing your expertise and your insights with us. As always, you've given us a lot to think about and some strong foundation on which to build our discussions in coming weeks and months.
Thank you, Alice. A pleasure.